My birth story is pretty wild. It was an unplanned, unmedicated, uneventful, thank God, birth in the back of an ambulance. As a labor and delivery nurse, I was in complete denial. So he looks again and he's like, yeah, you're crowning.
Motherhood is all-consuming.
Having babies, nursing, feeling the fear of loving someone that much.
And there's this baby on your chest, and boom, your entire life has changed.
It's a privilege of being your child's safest space and watching your heart walk around outside of your body.
The truth is, I can be having the best time being a mum 1 minute, and then the next I'm questioning all my life choices.
I'm Lo Mansfield, your host of the Lo and Behold podcast. Mama of 4 littles, former labor and postpartum RN, CLC, and your new best friend in the messy middle space of all the choices you are making in pregnancy, birth, and motherhood. If there is one thing I know after years of delivering babies at the bedside and then having and now raising those 4 of my own, it is that there is no such thing as a best way to do any of this. And we're leaning into that truth here. With a mix of real life and what the textbook says, expert insights, and practical applications, each week we're making our way towards stories that we participate in, stories that we are honest about, and stories that are ours. This is the Lo and Behold podcast.
Okay, I have the most fun for me to listen to. Maybe not fun for her to experience. Fun birth story for you guys today. I'm so excited to get you into this conversation. So we're just going to get right into it. Sara is back. Gestational diabetes nurse is back. She's in episode 16 with me, but we are going to hear her third birth story today. She is fresh postpartum. So if you are listening present day, she just went through all of this. I don't want to give you any more details. I'll just let her get into it and share the whole thing. But like I said, you guys, this is a fun one. Sara, it is so good to have you back. I want you to go ahead and introduce yourself. And when you do, kind of share who you are and what I mean when I say have you back, what you do, what we chatted about last time, and then we'll get into your birth story today.
Awesome. Thank you so much for having me back, Lo. I'm a big fan of your podcast and I'm so glad you're my friend because it's just so fun to talk to chat with another nurse. Like you totally get my heart. So my name is Sara. I am a labor and delivery nurse, a high-risk OB nurse, and I help mamas who have gestational diabetes navigate everything about gestational diabetes without confusion, without stress, so I could really help support you have a healthy baby, healthy pregnancy, smooth birth. And I know it's so challenging and the lack of care is so sad right now, but that's basically what I do in the online space. And I am a mama of 3 boys. I just had my third on May 17th, which is wild. So he's a little over 2 months now. Thank God. My birth story is pretty wild. It was an unplanned, unmedicated, uneventful, thank God, birth in the back of an ambulance.
You told everybody right away we were going to save it for the end.
I know. I just wanted to throw that out there because
it could actually, for some people, could be a bit of like a trigger warning or, hey, it sounds a little chaotic, honestly. I mean, yeah, when you said that's how it was, immediately I'm like, I need to hear this story because typically they are interesting stories.
Yeah,
for sure.
Especially as a labor and delivery nurse, and especially if it's your third baby and you're not planning a home birth.
Yeah. There's a lot of especiallys in there. But I think, I mean, we'll get into it, obviously, but anyone who has a birth story like that is very likely running into a variety of things they did not expect, did not want, or did not plan for, whether or not you work in this field or you wanted even, an unmedicated birth, whatever it is. And again, I want to hear all of that from you. I mean, this type of story is going to shock all of us when we're going through it, regardless, I think, of even what we were planning or wanting or envisioning. So I want to mention really quickly, first of all, I sent someone in my neighborhood to you because she got an unexpected gestational diabetes diagnosis. And so I know you mentioned that's like who you are and what you do work-wise. And then Sara was on episode 16. So we're not going to really get into her work and what she does. But if y'all want to listen to our episode together, that is, we talk kind of about we lean into more of what she said, helping you guys figure out how to do, your pregnancies well and confidently and with less of that confusion that follows that gestational diabetes diagnosis. And so that is episode 16. If you guys want to go ahead and listen to that as well, or you're running into that at some point in your own pregnancy, that's there too. And we can go ahead and we will link that in the show notes too. But Sara, if it's cool with you, I know we mentioned before we started, let's get into birth story. We are going to talk about birth story number 3, since there's a lot of details and interesting stuff in there. But why don't you kind of set us up with where you're at after having your first 2 babies? I know they were close together, like what those looked like, what you loved, what you didn't love, like, so how that all kind of led you then to what you were hoping for 3. So how did those first kind of birth 1, 2 go? Give us big picture overview.
Yeah, I love that question because I was basically planning my 3rd based on my history. And that's really funny because birth is unexpected, as we all know now. So my first, I was actually 40 weeks and my doctor sent me to MFM to do a ultrasound and do a non-stress test because after when you're post dates, that's just typically the protocol, just to make sure baby's doing well, placenta's functioning well, all the things. And so when I went to MFM, my fluid was actually low. It was less than 4. So that meant, and the non-stress test was not reactive. So baby wasn't really happy on the monitor. And basically based on that, they recommended induction. So my first was actually an induction, which I really didn't want, but based on that situation as a nurse, I understood that this is the best situation for me and my baby. I actually had a very positive induction story. I was only 1 centimeter when we started. I got 2 Cytotex, like the oral drink, and I broke my water on my own using the birthing ball with a wireless monitoring, which was really nice. And I got an epidural at 3 centimeters, which I planned, not at 3 centimeters, but I planned to get an epidural only because I worked in labor and delivery and I knew like all the doctors and I just felt comfortable. Like this is something that I planned and I knew I wanted. So I got to choose my anesthesiologist, which was really nice. And it was just a really positive experience. My mom is actually a labor and delivery nurse that works in the same hospital that I gave birth at. And she's like a night nurse, over 20 years of experience. And so she was by my side, which was so nice because I felt, that like kind of doula, kind of like mom, like I just felt so comfortable, so loved. My husband was there and we got to choose like the nurse that I had and everything went so well, even though it was a vacuum delivery and I did have a prolonged decel, which the baby's heart rate went down for a couple of minutes. Even though all those things happened, it was just a positive experience and I loved my epidural.
Oh, you do.
Yes. So I was really happy. The only thing was that with both my kids, like my blood pressure would drop with epidural, which was expected. So they just kept giving me fluids and medications, which was a little annoying because you do get swollen. But that's the only bad side that I saw from epidural. With my second, fast forward 15 months later, I went to my doctor's office, my OB, for my 40-week checkup. And she checked me and she said, "You're closed." So I was kind of disappointed. I was like, oh man, like my kids are 15 months apart. I would think that I was a little more dilated, but we all know that means nothing.
True.
So I went home, I started contracting, and my mom stayed with me. My mom is an angel. Thank God. She stayed with me throughout the night. I started contracting. And then at some point, like 12 a.m.-ish, I started contracting more regularly and then I threw up. So we thought, oh, like maybe I'm in active labor, right? So she kind of dragged me to the hospital because I was like, I don't want to go too early. But she was like, I think you're more now. And so we got to the hospital. It was actually 2 centimeters, which I was a little discouraged, but I knew I wanted an epidural. And later we learned that he was actually sunny side up. So that's probably why I felt so much more pain. So I ended up getting an epidural and I was so comfortable, so happy. My doctor went to her office. It was like 5, 6 a.m. She's like, "I'll be back for you." I was like, I'm not going anywhere. I was so happy, so comfortable, rested. She came back like around 4-ish, broke my water. We talked, chatted a little bit. She just gave me a drop of Pitocin and I delivered like less than 2 hours later. And my baby was significantly like bigger. He was like A3. So it was a really positive birth experience. Loved my epidural again. This time I'm so type A. So I was like, okay, I'm for sure going to go past 40 weeks. So I planned everything accordingly. I was like, okay, I'm going to work up until my due date. My due date was Wednesday, May 20th. I'll work Monday, I'll work Tuesday because I work in MFM. It's not like strenuous labor. I'm not like pushing stretchers or pushing with patients. Like when I was pregnant with my first, I was still in labor and delivery. So I like stopped working at 30 weeks. With this one, I was like, it's not like, what am I going to do at home? Like, let me just work till the end. It's fine. And then on that Sunday, I had a whole day planned because I was like, that's my last day off. And then Wednesday, I was going to go into MFM, and I was for sure in my mind, I was like, oh, they'll send me in for an induction because my fluid will be low or something. And if they don't, probably Saturday night, my doctor will induce me, not because she's like pro induction, but I'll be like more for like 40 weeks and something, and like probably the NSC won't be reactive or whatever. Like
I
most
love
likely,
that you were telling yourself like all
yeah.
of this is a very specific story you were writing.
Yeah. Like, and everybody was buying into my story. Like my mom didn't take, my mom didn't take, my mom didn't take off everything. My husband was like buying into it. And it's really funny. Also, like side note, we actually moved from my apartment to my house that I'm living at now when I was 36 weeks. So everyone was like, you're going to go into labor. And I was like, no, I was shrugging them off. Like, no way. I'm not going to go into labor. Like I go post dates. And even my coworker, she was like, oh, you're going to break your water. Like I broke my water. Then I moved and I was like, nah, I doubt it. So, I mean, thank God it was a lot, but thank God, like nothing happened. At my 38-week visit, I was 1 centimeter. So, and my doctor was like, oh, you're only 1. And I was like, I don't care because it doesn't mean anything. And I kind of like expected it. So in my mind, I was like, okay, I'm for sure going post dates. And I even arranged like childcare on Wednesday because I was like, okay, like, as a mom, when you have other kids, it's so like stressful about going into labor. Like, I understand why people do elective inductions now because at least you could like plan your childcare if like someone has to fly in or whatever. So I was like planning everything out. So the Sunday that I delivered was a Sunday. I was 39 weeks and 4 days, and I had a whole day planned. I woke up early.
Can I just say it's so funny to me that you didn't think you might have a baby at 39 and 4?
No.
Like lots of people have babies at 39 and 4.
I know. I was
like,
in denial.
No, I'm not going to. It's like my head's like, no, who would be surprised? Like, why are people surprised when they go into labor at 39 and 4? But obviously based on which, like you said, means nothing. I know.
And I was 1 centimeter in the doctor's office, which means nothing. But like based on my other 2 births, I was like, okay, like nothing's gonna happen. Whatever.
Right.
Wrong.
No, I get it. It just makes me
wrong
laugh.
mentality. I know. Now I'm laughing.
Yeah.
So the Sunday that I delivered, I had like a whole day plan. I woke up early. I went to get a full body wax because I was like, let me just get that out of the way. Not because you have to, just because I like it. I mean, we're all women and it's my doctor and like I feel comfortable, but I was like, something for me, And then after that, I went to do mani-pedi. So I was like, let me just get that out of the way before the baby comes. After that, I went to do acupuncture. I don't know how you feel about acupuncture, but I love acupuncture for labor. So I actually did it with both my kids. But it's funny because I did 3 sessions with both my kids before I delivered. And this time I only did 1. So I don't know, but
maybe that's less is more. Maybe
I don't know, maybe, but I do see like, I feel like it really makes a difference. And there's so much like evidence based on that. But anyways, I squeezed in the acupuncture last minute. I was like, you know what, let me just do it one time at least. But by Wednesday, if they induce me, at least I'll be like a little bit softer, in my mind. And so after the acupuncture, I actually like got up and I was like, oh, I feel like some contractions. That's so interesting. But it was irregular. I was like, whatever, it's fine. Maybe something like triggered something, but it'll go away. Maybe I'm dehydrated. I was running around all day, Mind you, my husband is with the kids in the park and trying to like distract them, my 2 boys, while I'm doing all my million errands. So then I come home and my in-laws came over to play with the kids and I decided to make dinner. So I was like, let me just make like a lot of food so that I have leftovers in case something happens. Like, we have food in the house, which again, as a mom is like so stressful when you go into labor. And so I'll never forget, I made bolognese and fresh salad. And then my kids they were so tired. So my husband's like, let's put them to sleep. So thank God. I remember thinking like, oh my God, we get to put them to sleep. I'll eat dinner. I'll take a shower. I'll chill out in my bed. Like all is good. And so, when you have a bigger gap, it's so nice in terms of like bedtime. And so they went to sleep like around 7:30, and then we sat down to eat dinner. And as I'm taking like my first bite and then my second bite, I feel a strong contraction. And I remember like imagining like a balloon. I don't know why, but I imagined a balloon, and I like, as the contraction was getting stronger, I'm thinking to myself, oh wow, that's actually a strong contraction, and it's like squeezing a balloon and squeezing and squeezing. And then I hear a pop, and then I feel like water gushing everywhere, and I jump out of my chair, and I'm like, oh my God, my water broke. And it's so funny because like it could be your 10th baby and you could still be freaking out when you break your water, right? And so my husband just starts laughing because like everything was wet. And it's so funny because like as a nurse, you can never turn off your nurse brain. At least I feel. So I right away look
I
at the
can't
time.
either.
Yeah, I right away look at the time and I'm like, okay, 7:45, clear, SROM. Okay.
Good job.
Yeah. The whole time I was doing that. And so I'm like, oh my gosh, I was freaking out. And my husband's like, I think you should stop eating. And I was like, you know what? You're right. Because it was
Wait, why? You
so
can eat during labor. I'm
yeah,
like, eat.
I know, but like I remember he remembered with my second one that I like threw up
The
everywhere
throwing up.
from the
Yeah.
pain, and I hate throwing up. And
No,
also it
the
was kind of
worst.
a heavier meal, like pasta with like ground
Yeah.
meat and like vegetables. So I was like, you're right. Like I don't want to, no. So I stopped eating, and I immediately panicked because my mom was working that night. So I was like, oh man, she's working. So I call her. She's not answering the phone. And I'm like thinking, oh my God, she's in charge probably, because she's usually in charge because she's in most experienced that night. So she finally calls me back, and I'm like, oh my God, mom, my water broke. She's like, she right away, she has her charge nurse voice, and she's like, don't panic. I'm going to let your doctor know. I'll get a room ready for you. It's pretty busy here, but I'll get a room ready for you, and just take a shower and head over. So I was like, okay. And I'm in such denial. So I start to wash the dishes and like start to put everything away. And my husband's like watching me, and he says, oh, how often are you contracting? Because I'm assuming that I started to look uncomfortable to him. And I was like, I don't know. It's fine. I broke my water. I'm going in. Who cares? And he was like, no, like you seem like you're like contracting often. Like, are you timing them? And I said, no. And he said, okay, let me start timing them. So I'm washing the dishes and he's timing them. And he's like, I think you're contracting too often. He's like, it's like every like 6-ish minutes. Like, I think we have to start going to the hospital. He's like, just leave the dishes. I'll do it later. So he's like, just hop in the shower. And then my grandmother really wanted to be part of my birth. My grandma loves birth. She loves anything to do with birth. She used to work in the delivery room, like as a CNA. I'm assuming, I don't know. And so she was like, just call her. So I call her, and she's like at her brother's house, and there's so much people in the background. And at first I'm like, I don't know. And he's like, just tell her that we're going to the hospital. So I tell her, okay, like I broke my water. She's like, oh my God, can your husband pick me up? Like, I'm ready. I'm coming. So I'm like, okay. So he tells me, my husband's like shoving me to the shower. He's like, just go take a shower. I'm going to go pick up your grandma, 5 minutes, and just throw, like, basically my bag was packed, but he was like, just throw in like your last minute, like your AirPods, whatever. Like, I'm going to come take you to the hospital. Or actually, we were thinking maybe my father would come and my grandma would go with me first, and then my husband will come and he'll stay with the kids. Like, that was what we were thinking. So anyways, I'm like, okay, fine. So I go take a shower, and I in the shower, I'm like thinking to myself, the shower will probably like relax me, and maybe the contractions will stop or they'll ramp up. Who knows? So I come out of the shower, and I was like, okay, let me just put some makeup on just so like I don't look so scary. Like I feel a little bit better, like throw something quick, right? So as I'm doing my makeup, I feel the contractions, and they're getting stronger, and to the point where I could not stand. So I grab my birthing ball, and I sit on my birthing ball, and I just like breathe through it, and I feel so much pressure. And I start like, oh my God, like, what does this mean? It's fine. Probably because I broke my water. I feel more pain. There's no more cushion around the baby. Like, I breathe through it. It happens again.
I hate interrupting people during their stories. But I'm just so curious, since you had the epidural with both of your first two births and got it kind of early, I guess, if you're quantifying when to get it. Do you feel like you could tell when you were at home in these contractions where you're saying it got so intense that you were experiencing something a lot like bigger or stronger than you had experienced prior? Like, I guess nurse you, were you going, okay, this is like, I'm moving along. I think I'm probably farther than I think I am because this feels so different than it did when I was 3 centimeters and got that epidural.
So actually, it was the opposite. In my mind, I was like, oh, I'm for sure 1 centimeter. I was in denial the whole time. Like even in the ambulance, I was like, I kept saying, I will be so embarrassed to come to the hospital in the ambulance with the stretcher and the guys and be 1 centimeter. And
I
it's so
think that is
funny
a labor
because
nurse thing, by the way, where we're like embarrassed if we screw it up, because I'm the same way. So that sounds very familiar to me, where I'm like, I'll be so embarrassed that I like just don't want to go in because what if I'm wrong? So
yeah, I agree, because as a labor and delivery nurse, like usually the patients that come with an ambulance screaming on the stretcher, and of course, like my heart goes out to them, but like it's either they're closed or they're 10 centimeters. Like there's no in between. And so in my mind, I was in complete denial. So but I called my mom. Thank God I called my mom, because I she answered me, thank God. And I was like, Mom, I feel rectal pressure. And something in my voice made her like realize that, no, this is very serious, even though I was in denial. And if I would have never called her, or this happened during the day, like thinking now, I probably would have had the baby at home because I was in such denial. So my mom heard it in my voice that sounded farther along, even though I was in denial. And so she, thank God, had the wisdom to say, you know what, we know a doula in the area, and the doula has a son who is a volunteer EMT. And she said, let me call her so that her son can drive you to the hospital. And in my mind, I was like, yeah, that's actually a great idea. Like, he can drive me in his car. I don't know why. I was in such denial. I was like,
that's kind of what it sounds like your mom saying, and like, I'll just call them instead of calling 911. It makes it sound like you're just calling a friend. So I could see why you were confused.
Yeah. So she says, let me just call. And I was like, okay. So then I call my husband and I'm like, where are you? And he hears it in my voice that, she sounds more serious. So he says, no, I'm parking the car. We're coming up. I got your grandma. We're coming up. So I said, okay, great. So I throw my makeup in my bag and I come down the stairs, and as I'm coming down, my grandmother is coming up and she sees me and I'm having a contraction, and I grab my birthing ball and I'm literally like, I could not walk with a contraction, like meaning like I felt like it was coming out, the baby. Like it was so much pressure. I had to sit. I guess I was sitting to hold the baby in. Maybe that's what it was. But I literally had to sit on the birthing ball to breathe through it. And my grandma saw me and she says, why are you still home? Like, we need to go. And as she's saying that, we hear sirens and a bunch of guys come into my house. And I'm like, what is happening? And so I get embarrassed, and the guys start asking me questions like, okay, like what's going on? Are you in labor? How many weeks are you? And I'm answering them as a nurse. I'm like, oh, this is my third baby, G4, P2. I had one miscarriage, positive blood type, B positive, negative history, negative GPS. Like, I'm giving them report. And then they're like, okay,
so
like it was hilarious. And I remember like my brain just like answering them automatically, like I was on autopilot. And so they say, okay, let's get an ambulance. And I said, no, I'm not getting in the ambulance. I thought you're going to drive me to the hospital. And he goes, no. And then I have another contraction, and I was like, guys, give me a minute. And I sit on the floor and I'm like, I have to sit. And they look at me and they're like, get in the truck. You're getting on the stretcher. And I'm like, no. Let me finish my contraction. I'm going to walk. So I remember the contraction is over. I grab my shoes and I put them on and I literally walk to the ambulance. Because in my mind, I'm like, oh, like this is so embarrassing. I'm 1 centimeter. Like they're going to put me on a stretcher. Come on. So I finally get into the ambulance and they start asking me more questions. And it's funny because they saw that I was so calm, I guess, so that they were like kind of joking around with me. And I see like 4 guys, like one guy in front of me, a team leader. Mind you, these are young, strappy, like guys.
Of course
like
they are.
like no more than 40. And like 2 guys on my right, 2 guys on my left, and my grandma disappears. I don't know what's happening. And I keep asking them, like, where's my grandma? And he's like, oh, she's in the front of the ambulance because there's no space. Like, it's pretty crowded. So then the team leader, he says, okay, we're going to cut off your underwear so we could see. We're not going to check you. We don't know how to check, like, vaginally, like, what's your exam, but we're going to just see, like, what's going on. And I was completely mortified. I was like, oh man, imagine I'm 1 centimeter, they're cutting my underwear. Like, this is like crazy story, you know?
So funny. They wouldn't know you were 1 centimeter, so that's good.
I know, but my doctor would know.
Yes, they would.
So that's like literally the theme that I was thinking of. And so they cut off my underwear and he looks and like, I have to give it to them. Like, they really tried to like make me feel comfortable. And he looks and he's like, I don't see any crowning. So we're good. So the driver's driving and they're still asking me questions and they're like joking around and whatever. Then I have a contraction and I'm like, okay, guys, no, I have to push. So then he looks and he's like, okay, I don't see crowning. So it's fine. Just keep breathing. And the one guy on my left, he's like this big guy. And he goes, you can squeeze my hand if you want to. Don't worry. He lives 4 houses on my block. Does. Like 4 houses ahead. Like this is like, yeah, like so funny because these are all volunteer EMTs actually. So that's why they responded so fast. They literally, like, the team leader lived like a block away from me. This guy lived like on my block. My mom called that one guy. Like, this was maybe 20 guys on my block. It was, I'm not even exaggerating. They responded so fast, thank God. And so anyways, so then I have another contraction and I'm like, guys, no, I have to push. Like, this is not a joke. And so he looks again and he's like, yeah, you're crowning. And he yells, the team leader yells, pull the truck over. And I'm,
Hey friend, quick pause for just a second. If you are listening to this podcast because you want to feel more prepared, more confident, and less freaked out about birth, that is exactly why I created the Your Body, Your Birth course. This birth course will not tell you what kind of birth you should want, and nobody has the right to do that. It is about helping you understand what's happening in your body, what your options actually are, and how to walk into your birth feeling grounded, excited, ready, instead of overwhelmed and scared. When you have education like this, everything changes. Your mindset, your conversations with your care team, and the birth experience itself. No more relying on random opinions, okay? Stop scrolling. Take intentional action with me and start trusting your body, your voice, and your decisions today. Head over to www.thelabormama.com/birth, also linked in your show notes, and be sure to use the code podcast at checkout to save 20% and start working towards this better birth for you right now. Okay, let's get you back to the episode.
In my mind, I say, oh my God, you know that point of no return? Like, as a nurse, it just, like, you see the doctor, something happens, like, you're just like, oh, like, things are about to get real. Like, I had the same feeling when the doctor pulled out the vacuum for my first one. Like, I saw the vacuum, I was like, no, like, this, I got to give it all my all. And so when he said that, I was like, I got scared because I was like, I don't know, like, what if it's a shoulder? Like, what's going to happen? So I really pushed, like, as hard as I could. And then I hear him, like, say, can you hold your legs? And I was in so much pain. I guess it was
like, hold your own legs back. Yeah.
Yeah. So I guess because it was like the ring of fire, like, I felt so much like I told him I physically can't, like, I can't. I remember saying that. And so the 2 guys on the one side hold my leg, the 2 guys on the other side hold my other leg. And he tells me, you have to push. And in my mind, I'm like, oh my God, like, what does he see? So I pushed so hard. After I found out it was like a cord around the neck. So he probably was like, we got to get this baby out. And so baby comes out. I remember looking up and I saw a clock and it said 21:33. So as a nurse, again, I go 21:33. Nobody's paying attention to me, and they're just putting the baby on me. And like a couple of minutes later, somebody goes, "Does anyone remember the time of the baby?"
And
I go 21:33. Yeah, everyone kept asking them, and even when we went to the hospital, like, all the nurses were asking, like, "What time is the birth?" The doctor was asking there, and I'm like 21:33. But yeah, so then they placed the baby on me, and there was like this foil. It looked like it was very interesting. It was like the sterile drapes that they put the baby on. So this was like, it looked like foil. And
Like a
later I
blanket,
learned
right?
that,
Like some sort of heat blanket. I know what you're talking about, like
yeah,
from
later,
TV shows.
yeah, exactly, like from TV shows. And like
Hmm.
later I learned that like it generates heat, like it
Hmm.
keeps the baby warm, which I had no clue. I never saw it before in the delivery room. And so, and I never had a patient coming in. Actually, I had one patient that delivered in her bathtub by accident, but that was the only time that I had a patient that delivered outside of the hospital, and I don't remember seeing that. It was pretty cool. So they put the baby on me, and of course baby is shocked. As labor and delivery nurse, I even knew that, like, even though this happened, like I was still like, oh. So the EMT, he says, don't worry, like baby's not crying, but it's normal, like we're gonna give the baby some time and just stimulate. And I'm stimulating the baby as he's saying it, like I'm rubbing my baby down to, get my babies to like cough up any juices and like start to perk up. And I say, don't worry, I know. Baby's shocked. It was a fast delivery and baby's kind of pale. And then finally, like baby started crying and baby's color got a little bit better. So I felt like more comfortable. Like and he was like, yeah, baby's doing better. Like he was trying to, make me feel better. And I was like, yeah. And then I asked them, do you have a hat? Because they didn't have a hat. And he says, no. And I'm like, oh, okay. And then he says, did you pack a hat in your bag? I was like, I actually did. So he was like, okay, well, ask your grandma to get a hat from the bag. So she finds sorry, my baby's in the background. She finds the hat and I put it on my baby. And now I feel like complete relief. Like my baby's crying. My baby's okay. Like the color looks good. I kept like looking at my baby and I was like in just shock. And they actually got even more nervous because the placenta was still in. And so they kept like checking and they're like, are you okay? And to see, and I'm like, guys, it's okay. The placenta won't come out right away. Like we have time. And basically, like I closed my eyes just because I was so exhausted and I was like in so much shock. So they got scared and they were like, mommy, are you okay? And I'm like, I am not. And they're like, don't
Oh
pass
my
out. I'm like,
gosh.
I am not passing out on you. I am just so tired. I promise you, I will tell you if I'm passing out on you. And then, so then I kept saying, did you tell my grandma? Like, where's my grandma? And he was like, oh, she knows. There's actually a mirror and she saw the whole thing.
Oh my gosh.
Which was,
from the front seat. That's crazy.
yeah, it's so crazy. And so she called the whole world. She called my mom. She called my husband.
Of course she did.
Yeah. And she like also like when we got to the hospital, like side note, she like took a video of the whole thing of them moving me to the stretcher. Like everything is out in the open. And she just like videotaping it for generations to come,
That's right.
Yeah, she's the best. But I was so glad that like even though like nobody was with me and I was so scared. I mean, I wouldn't say I was so scared, but it's different from my other two births. Like I was surrounded by like people I love and like my aunt came from Florida. Like it was a really nice experience. And so this time like to have her in the front at least was, I mean, in a way it was nice, but I wish like she was next to me, but but anyways, so they asked me, do you want to call your husband? And I said, yeah. So I called my husband, they gave me my phone and I called my husband and he's like, I'm so glad you're okay. Your grandma already called me. I was like, great. And he was like, actually, like I was watching you on the phone. You know how you could see somebody's location on your iPhone? So he was like, I was actually watching your phone and I saw that they pulled over and I was like, oh man, I hope she's not going to deliver in the ambulance.
That's so crazy. Yeah.
Yeah. And actually, it's really funny because like a week before, he told me that one of his friends, their wife delivered at home by accident. And he told me like over dinner, and I was like, ha ha ha, that's actually so funny. Like, that's nice, look, lucky her. She had a nice delivery, like as a joke.
Right.
But like I never thought it would happen to me, So like I guess he like kind of had like, oh, like that could happen. Like he thought that. So when my iPhone stopped, he like assumed that that's what happened. So yeah, so then they tell me, okay, ETA to the hospital is 20 minutes because they actually were doing me a favor, thank God. Like they were taking me to the hospital that I was going to deliver at and not like the nearest
the closest
hospital.
One. Yeah, that is really nice.
Yeah, like they knew, like, because my mom's told them, like, oh, I'm delivering in this certain hospital. So that was really nice. But they were like, ETA is 20 minutes. So I'm like, that's
so you
awesome.
never would have made it. Is that how
No.
long the commute from your house was? Like 25 minutes or so? Like if you guys had just gone and not stopped, how long would it take you to get from your house to hospital?
So yeah, it depends on the time. Like when I was working in labor and delivery, I can get there in like 10 minutes with no traffic. But that night was insane traffic. Like everyone told me like it was horrible traffic. So with the ambulance, it was 20 minutes. Like I would say 25 minutes because I delivered 2 minutes into the drive, and I was also
Right
giving them
away.
pushback.
Okay.
Yeah, I was like, I'm not getting on the truck. Like I wasted some time too. But yeah, I would have never made it. And actually, like, thank God, because my mom initially was like, okay, like maybe dad can drive you with grandma. Or actually, no, she was like saying like maybe like your brother could drive you and then your husband could come later after when your dad comes home. Like that way your husband can go to the hospital. We were trying to figure it out. And thank God I didn't do that because I would have messed up their car and they would have not known what to do for me.
That's okay.
Yeah, like it all like really like thank God it was really a miracle like the way it played out. So yeah, so like ETA was 20 minutes. I was like, that's awesome because like we basically finished here. But
Was your
I knew
placenta still in? Like they were willing to drive and wait for the placenta to deliver? Wasn't like that had
they
to
were
come out?
speeding
Okay.
up. Yeah, they were speeding up. They were getting nervous about the placenta being in, but I was like, guys, it's okay. We have time. Like, I was calming them down. And finally we get to the ER, like they gunned it and they tell me, okay, we're going to go through the ER. And I was like, can we not go through the ER because I still have the placenta and I need to be repaired and no, I don't want to go through the ER. So they were like, I'm sorry, like, unfortunately, like, that's our protocol. Sorry. That's our protocol. We have to go through the ER because, you're a patient coming in. So I was like, listen, like, my doctor's not going to be happy. Like, I need to go to labor and delivery. And they were like, I'm sorry. I was like, okay, I'm warning you. So finally we get to the ER and they open the doors and my doctor's standing right there waiting
like, give her
for
to me.
Like, give her to, like, legit.
That's
exactly.
awesome.
And yeah, and so they take me out, they give her a report like, okay, this is what happened, whatever. And she was like, okay, let's go to labor and delivery. And he was like, I'm sorry, like, we have to go through the ER. And she was like not happy. So we go through the ER and there's a team of people standing there, like 10 plus people with my mom in front as a charge nurse holding equipment. And I realized they call the code OB, which basically like it's just a name for like every hospital is different, but it's just a name that they call for like a team to come and assess a mom or a baby or both if they're coming into the hospital, like if something is emergent, like whether they delivering in the they delivered at home or they're coming in active labor to the ER, like, in the car or like something is going on. It's just a team of people just to make sure like all hands are on deck in case something were to happen. And so I'm like getting mortified because
were you like, we're fine, everybody go away, please?
Yes.
Like just put me in a room.
Yes, I was like, I'm fine. I just need to be repaired because I knew I was gonna have laceration. I mean,
Yeah.
I had it with both my kids, but like I knew it's probably gonna be like a little bit more or whatever. So I was like, let me just, like everyone, we're all good. Like no need to like call a code OB. And so my doctor and I see the ER like doctors and nurses like starting to approach the EMT, and my doctor goes, no, we're taking her to labor and delivery, and she starts pushing the stretcher with the guys, and we all like go to labor and delivery. We go in the elevator, and she looks at me, my doctor, and she says, are you okay? And I'm like, yeah, thank God. And she's like, as a joke, well, it's true, but like trying to make me feel better, she goes, at least you didn't have a C-section. Like, this is better, right? And I was like, yeah, thank God, So we get to labor and delivery and we're passing like the nurses station, and I see a bunch of like my coworkers and like doctors, and they're all like, hi Sarah, like, how are you, congratulations. And I'm like, thanks guys. Like I was so embarrassed. And they take me to a room, and there was tons of people in the room, only because like they just want to make sure, like, they don't know what's going on. They don't know how my bleeding is. They don't know what's going on with the baby. So there was like a few nurses with the baby. They took the baby to the warmer just to make sure baby was fine. Then the guys helped me move from the stretcher to the bed, and like all the nurses were like around me. They actually put an IV in me in the ambulance. Unfortunately, it was in the AC, like in the elbow, and like whatever, but they did put an IV for me. So as soon as they got me on the bed, I turned to my mom and I was like, can you please get me Toradol, which is like IV Motrin. I was like, I need something because I know like she's gonna repair me now, and it was just a lot. So my mom's like, yeah, of course. So they gave me IV Toradol, and my doctor was like, okay, like you have a laceration, we're gonna actually, first she waited till the placenta came out. So thank God the placenta came out on its own, like which I told the guys it's going to come out, like, it's fine, it's all good. And then she repaired me. I actually had a second degree, so it was the same as my first two. So thank God. But she did say, like, when she saw me, she was like, honestly, like, it looks like uncontrolled, like you had uncontrolled pushing. Like, it looked like, I guess, like more like irregular, like more like not so uniform, I guess, which unfortunately happens when you don't have like controlled pushing. But it wasn't like a third or fourth degree, which is actually really good, thank God. And yeah, so she repaired me. I have to say the repair was not fun, even though I got the lidocaine. It was definitely stinging, but it wasn't as bad as when she checked for clots. And I don't know if you remember, but that is like the worst pain. And they always warn you, like, okay, this is gonna hurt, but I'm telling you, that was worse than the actual delivery. And it was so painful that like it took my breath away. Like I couldn't even scream. Like it was so painful.
Was
And
she
it's not,
manually checking? I'm going to ask you to clarify in case people are like, what are you talking about? Was it like
yeah,
bundle massage from the outside, or you're saying like a
both.
manual check internally? Both. Okay.
Yeah, both. And they only do it because they're concerned that if there's clots still there, it can cause a hemorrhage. So it's really for your benefit. If they do that, they don't always do that, like as Lo knows, but it's something that if they feel like it's going to prevent any kind of complications, like a hemorrhage, they do that. So she said, like, you did have a clots, probably because the placenta was sitting there for a little bit, but thank God, nothing serious. But that was honestly the worst part. And yeah, after that, they clean you up and you get to hold your baby. And it was just, everybody was shocked. Everybody was shocked. My doctor was shocked. Like nobody imagined that. All the nurses were like, I remember one of the nurses is a male nurse, and he asked me, like, would you do it again unmedicated? Which I'm sure you were gonna ask me too, right? And so my answer to that is I would get an epidural next time. Only because
like that whole experience though is not, it's not planned
typical.
for. It's not gradual. Like I could very well see someone saying, I don't want to do it like that again, but maybe I would do it without an epidural if it looked more, let's say, quote unquote, normal, right? So I don't even know that you can answer that, because most people are not going to choose, even if you want an unmedicated birth. I'm not going to choose to have a baby in the back of an ambulance like that. I would never want that. And so then I'd be like, well, no, but if you're asking if I want to do this again, no, I don't want to do this again. So
no, they were asking more like, what's the difference between an epidural and like unmedicated? Like they wanted to know like how I felt, like would I do it again? And honestly, like it is nice not to get an epidural, only because my blood pressure dropped. And like I remember with my second one, I will never forget, like thank God my mom was in the room, only because my blood pressure did drop. And so I felt so dizzy, and I don't think I had it in me to press the call button. So thank God she was there, because I was like, Mom, I couldn't even talk. I was like, and she immediately pressed the blood pressure, and because she's a labor and delivery nurse, and then it was low, and she called like the anesthesiologist to come, and he gave me ephedrine, which is the medication to just raise your blood pressure. It's a common side effect of the epidural, but it could be prevented with fluids, like giving you fluids before. But yeah, I mean, that's the only thing that I didn't like about the epidural. I know a lot of people have like they feel really bad from the epidural, like in terms of like, they want to move more, or like they say that they have back pain after. I never had any of that, but that's the only thing that was nice, that I didn't get millions of bags of fluid. Because that's kind of annoying when you're like swollen postpartum, But yeah, I would get an epidural again.
Good to know. Okay, check. One question I did have, and I think I actually asked you this kind of briefly after I heard what happened, was just that question of precipitous labor like you had. So you said water broke at 19:45, baby at 21:33. So that's less than 2 hours. Very much a precipitous birth. Is a lot of times the fast birth like that can feel pretty traumatic, right? Because your brain has not caught up to what your body has done. And so there's just a lot of processing. Some people even grieving because they wanted a certain experience and didn't get it. Did you, or have you felt any of that stuff? Or has it more or less been like, it's just a crazy story and we did it and we're all good.
Yeah, I mean, definitely, I agree because in my mind, like I said, I was planning like, oh, I'll be induced and my mom will be there and my
Right.
aunt will come from Florida again. And like, I just had such a positive experience both times. And I loved how I was surrounded by people that I love and trust. And obviously it gets like the oxytocin flowing and it just like a very like, and my aunt made a video for me with my second baby. So like I can always watch it, you know, and it's just so sweet. And so this time I wasn't surrounded by anyone that I love. I mean, my grandma was in the front, thank God, but you know, it's kind of robbing me of that. But at the same time, I'm very grateful because I know like it could have been worse. It could have been something really scary. And the fact that it happened very fast, I feel contributed to me being in denial because in my mind, I was like, oh, I'm probably going to get to the hospital 2 centimeters like last time with my second. And so I was completely ignoring all the things. And I think that's why it's so important to have a support system that's actually not just that they love you and they're there for you, but that they recognize, no, I think you're in active labor. And thank God that my mom and my husband recognized that because I don't know what would have happened. You imagine like I broke my water driving and I would have been like, oh, it's fine, you know? Or if imagine I would have stayed home or went in the car with my brother or my dad, like it would have been a different story. And so I think those are the two things that you mentioned. Like it's kind of robbing you of what you envisioned. And but birth is so unpredictable, and it's nice to know that you just have to let go and kind of just go with it because it is beautiful at the end of the day. And all births are beautiful, but yeah, it's just something wild.
It's a fun story. Loved hearing
Yeah,
it. You're
so
such
fun.
a teacher and an educator. I feel like everyone just got all these mini lessons about different topics like ephedrine or Toradol or whatever.
Yeah.
And right here at the end, though, I mean, it's such a decent way to say, hey, this is why like being educated or having a care team that's educated is so valuable because it is unpredictable. Like you could not be more educated and your birth still surprised you. Like you still needed people to come around you. You still needed your own knowledge to rely on. And so it's just such a good picture, I think, of when this kind of stuff happens to the most educated of us. You know, I think it's just so valuable to say, I'm so grateful for my education or for that of my mom or, you know, what my husband had, whoever, because it really shows because you need it. You needed it. Right. And so I think that probably was for you a really big difference between that being a really terrifying, traumatic experience and that being one that certainly you lost some stuff like you're talking about, right? But also that you could walk away from and still be able to say, but it also was beautiful. Like I felt safe or I felt, let's say, I don't want to say comfortable, like labor is not comfortable, but that you felt good in the midst and you felt kind of covered in the midst of it. And I think a lot of that is just because you have, you know, so much knowledge and education to kind of walk with you. Yeah, for sure.
Yeah, I agree. It's so important to get education because you don't know what's going to happen. And like, at least you know, like if A happens, then B will happen. And like, even with the epidural, like if you know, like, okay, with the epidural, what steps will happen? Or if you don't get an epidural, like if you don't know how to breathe or cope, like some people like me, like, oh, I'm going to get an epidural. But like, what happens if you don't have time to get an epidural? Like, do you know how to breathe? Do you know what to do? And in my mind, I really, at the end, I was just like, okay, just you need to focus on your breathing because you're not getting an epidural.
Yeah.
And it's so funny.
It's all you got.
Yeah, it's all you got. And it's so funny because I asked my grandma after. I mean, like we always talk about it. Like every time I call her, she always tells me like, I'm still thinking about your birth. Cause it really was something. Like she's been at so many births. Like she'll go to like a cousin's birth, like for fun. Like she loves it. And so I remember asking her, did I scream? Like, how was I in the ambulance? Like, like, was I coping? Like, I just want to know, like, cause I remember I felt like I was out of body, you know? And she told me, no, you actually didn't scream. Like you were listening. I heard you like breathing and like you were really like trying your best. And that's all you can really do when you get educated. Like at least you know, like you have everything in you, the tools to navigate all this. And it's just really hilarious when she like describes how like I was like, oh, baby's coming, you know, like I was totally like Just going with it.
Just going with it. Sometimes that is part of birth, isn't it? Well, thank you,
Yeah.
Sarah, for sharing all that with me. It was like so fun to hear, especially because most of us it won't look that way, right? And so it's like a door into a scenario that most of us will never experience, right? So thank you for sharing that. Will you remind all of us where we can find you, also professionally, for the work you mentioned that you do when you start? If someone wanted to chat with you about your birth or reach out to you for the work you do, where can they find you?
Awesome. Thank you again, Lo. This was so much fun. You guys can find me at Gestational Diabetes Nurse on Instagram. I have tons of tips and tricks for navigating gestational diabetes and fasting blood sugar guides, all the things to navigate what's going on at your doctor's office, how to interpret your blood sugars, how to have a healthy baby, hopefully in a smooth birth. Learn from me.
It's perfect. Yeah. Okay. And then if you remember this, I ask everybody this before they go. What is one thing in your life that is bringing you a ton of joy? And we're probably all going to guess the answer, but go ahead.
I love that question. Honestly, I'll be honest, this baby and this postpartum is bringing me tons of joy. I was so scared for this postpartum. I was like, oh my God, I hate postpartum. I'm not looking forward to it. But I have to say, there's something about a third baby that you enjoy it more. You enjoy the cuddles more. Even now, my baby's a little bit not happy with me, but I'm happy to hold him only because I know it's going to be so short and I don't want him to get older, but it's bringing me so much joy to be with my baby.
Your third time momness is showing up because you've been recording and taking care of him and you haven't even blinked. You haven't looked anxious. So it's a real thing what you're talking about. I just got to watch it happen during this interview. Well, thank you again for coming. Thank you for fitting it in because you are a busy mom, I know. And I'm just looking forward to sharing this one. I think it's going to be fun for a lot of people to listen to. So thanks.
Thank you again.
Thank you so much for listening to the Lo and Behold podcast. I hope there was something for you in today's episode that made you think, made you laugh, or made you feel seen. For show notes and links to the resources, freebies, or discount codes mentioned in this episode, please head over to loandbeholdpodcast.com. If you aren't following along yet, make sure to tap subscribe or follow in your podcast app so we can keep hanging out together. And if you haven't heard it yet today, you're doing a really good job. A little reminder for you before you go. Opinions shared by guests of this show are their own and do not always reflect those of myself and the Labor Mama platform. Additionally, the information you hear on this podcast or that you receive via any linked resources should not be considered medical advice. Please see our full disclaimer at the link in your show notes.